Hello, hi, good afternoon. This is Dr. Binyang from Dental Chicago. Often we have a lot of questions from our clients about dental veneers. Today, I'm going to answer some of the questions. I hope that can help you.
Dr. Yang, what are veneers?
Dental veneer is like a shell on the teeth. Okay, so we will do very minimum invasive preparation on the teeth, so then we can put a shell on the top. So it looks great, and also it's very healthy for the teeth.
When would a dentist recommend using veneers?
When the dentist recommend dental veneer for our clients, that depending on the situation. Number one, if the patient has like a standing teeth, or they have crowding teeth, and also after root canal treatment, the tooth have discoloration, so we can also do the dental veneer. And also we can use the dental veneer to close the space between the teeth to make the teeth much line up beautifully.
What's the difference between dental veneers and crowns?
So the difference between the dental veneers and the crowns, depending on how much like coverage on the teeth. So dental veneer normally we do on the buccal surface, and then we will not touch on the lingual surface, or vice versa, we do on the lingual surface. So basically, one half of the teeth may be covered by the veneer. However, for the crowns, normally we have to prep like a full teeth, including 5 surface, so that we call the full coverage crown. Comparing to dental veneers, crowns are more invasive, so that's why dental veneer is very conservative to save the patient tooth structure. So which, especially when patient has a healthy tooth structure, dental veneer is much more minimally invasive.
What's the process for placing veneers?
So when we need to place the veneers, normally we need to have number one, do very well thoroughly treatment plan based on the diagnosis, so then we can prepare the teeth in minimally invasive. And very important, the margin has to rest on enamel. The enamel bonding is the successful key to the dental veneers. And then we will have treatment planning and wax up, and then prepare the tooth, take impression, and then we can deliver veneers in another visit.
Will veneers and bonding cement match my tooth color?
That's depending on the materials we use for dental veneers. If your veneers are made of the composite, yes, that can be easier to match your current like a composite restoration. However, if you have a composite tooth on the side, and then we do porcelain veneer, which is sometimes, most of the time, we use Emax ceramic for the veneer. The shade can be a little bit different. So that's why I would recommend, if you have a composite restoration on the side, we can always do composite veneer. Of course, if the composite is in the back teeth and the veneer in the front, that will not affect much. So porcelain veneer or Emax ceramic veneer are much more looking good, and also no staining over the long time.
What are the differences between porcelain and composite veneers?
The difference between the composite and the Emax or porcelain veneer are the materials, right? So composite is made of the kind of like polymers and the fillers inside. The Emax is made of ceramic or porcelain. We needed to bake this veneer into the oven at a very high temperature. So that's why based on the materials components difference. Composite veneer, over the time has a little like a staining, and and the strength is not so well as porcelain or Emax veneer. In contrast, Emax veneer can be much looking much better, and also is more competitive with your gum, so less irritation, and over the time no staining, much stronger.
What should I do to care for my dental veneers?
Yes, that's a great question. So when you had veneer, what you needed to do at home, for the home care, number one, you should brush and floss the teeth very well. That's very important. Second one, you need to wear night guard. Night guard is excellent prevention tool. So it's a small investment. However, it can help you to prevent you grinding, clenching the teeth during the night. So by accident, you may fracture your veneers. However, the night guard can help prevent you from fracture veneers. So that's why night guard is highly recommended and almost like a must for my patient after I deliver the veneers.
How much do veneers cost?
The cost of a veneer is also depending on the materials, right? So we can do composite veneer. The range can be from $800 to $1,200, and for Emax veneer, that can come from $1,200 to almost like $1,600 veneer dollars. So because of the technician, the materials, and also staining, more aesthetic character can be added to the veneers. So that's why there's a certain variable in the price.
Are there financing options available for getting veneers?
Yes, of course. So in our office, you can apply for Cherry, to help financing your, treatment plan, make that much more affordable.
Does insurance cover the cost of veneers?
Does insurance cover the cost of a veneer? So that's a great question. Depending on the dental insurance you have, and also the etiology, what's the reason you need a dental veneers, right? So if you had a root canal treatment tooth, and then tooth is very broken down, so veneers or crowns, this may strengthen the tooth, so prevent you fracture the tooth. So that can be covered by the dental insurance. However, if more for aesthetic reason, dental insurance may not cover, so that will be a out of pocket cost.
How can I schedule a dental veneer appointment?
How to schedule one veneer appointment? Very simple. So please call us 312-929-4783. So you can request to see Dr. Yang for a veneer consultation. I will be very happy to help you. So I hope I answered most of your questions. So then if you have any question, please call us 312-929-4783. I would love to give you the consultation and give you my expertise question. Thank you.